cases in St. Louis County, and 650 residents have lost their lives. Both of those numbers would be far, far worse if it were not for the actions of our public health department early on and since then. And those numbers would be far worse if it weren't for the patience and the cooperation of our residents and our businesses in St. Louis County with the stay-at-home orders, masking guidelines, social distancing, and group gathering limitations. Testing was a challenge from the get-go with the national shortage. Communities were competing with each other to get the needed supplies. Eventually, production of test materials increased, and St. Louis County was aggressively able to purchase testing equipment and supplies, and we were at the point where everyone in St. Louis County could get a test who needed one. With better access, now in St. Louis County, 2,800 tests on average are performed every day. A robust testing environment is critical to help us know where coronavirus is spreading in our community and how to get help to the people who need it. With funding from the CARES Act grant, we've been able to purchase more tests. And last week, we were able to purchase 30,000 of the new saliva tests. We'll begin giving those tests at our public health department locations starting on Wednesday. But we'll also continue to use the nasal swab PCR tests that we have been using. To increase accessibility to testing, we are continuously looking for new partnerships especially in areas where the virus has disproportionately impacted our residents. And today I'm pleased to announce that we're entering into an agreement with People's Health Center to provide more testing in North County. We have set aside $4 million from CARES Act funding to increase testing sites, more testing equipment and supplies, and again make sure that we're making every effort to get tests to people in St. Louis County. Our federally qualified health centers, our FQHCs, have been exceptional partners in serving those who need care, and People's presence in North County will provide additional locations for COVID testing. We continue to work with FQHCs and other testing partners to get them the funds that they need to increase testing locations, and we'll have more to say about those relationships as more contracts are announced in the coming weeks. People's will be getting an additional $578,000 through the end of the year for testing. And once those testing locations are up and online, then you'll be able to find out information. They'll be added to our list of locations at sdlcorona.com. I also want to give a quick update on another issue. Our Department of Health no longer has a backlog of tests that need to be reported. Working double shifts and through the weekend, they've been able to go through, check for duplicates, and enter into our testing system the tens of thousands of results that were sent to us by one urgent care center in the community in 2 batches over 3 days. Timely reporting is critical to effective contact tracing and managing the spread of the virus in our community. Now, our urgent care centers have been in touch with us this week, and they've assured us that they're complying with the reporting requirements, and I want to thank them again for their hard work in getting that information to us. And I would be glad to answer any questions.
This was the first weekend since the restriction was in place as it relates to bars closing at 10 o'clock. Any problematic areas? How did it go? What are you thinking?
Yeah, we've had some complaints, and we'll be investigating those complaints over the next few days, sending warning letters and following up on them. We want to make sure everyone understands our guidelines. They have a fair chance to comply with those guidelines, and then we will begin enforcing them.
Is that a handful of complaints? Quite a few? How would you qualify it?
Oh, a dozen or so. Some of them may be duplicates, so we need to check on them. Any questions?
I have a few. Just going in about the video of large crowds in Pike County and Lake of the Ozarks this weekend. Has the county's contact tracers ever found outbreaks related to vacations at Lake of the Ozarks? And are you asking people to self-quarantine when they return from these events?
anyone who is at a gathering anytime that is not social distancing or wearing a mask should self-quarantine to protect their family, their coworkers, and everyone else out in the community. We did have some cases that we were able to trace back to crowds, including events at Lake of the Ozarks. That remains one of many opportunities in the community. Whenever social distancing is relaxed, people are wearing masks in large crowds. With the presence of COVID in our state, especially at this point in time, the likelihood of becoming positive increases dramatically. That's why masking and social distancing is so important to get us through the next few weeks.
Regarding those that are in quarantine and isolation, how are they able to vote during the primary?
Yeah, the question about voting, if you haven't voted absentee and you are in isolation or quarantine by orders of the Public Health Department or your physician, the Board of Elections has announced that they will be able to provide voting in your vehicle at the Northwest Plaza location. And if you call the Board of Elections, I think that number is 615-2800, 314-615-2800, then they will make arrangements to come out to your car at Northwest Plaza if you're under an isolation order or quarantine order, so you'll be able to vote. But if you're in isolation, we ask that you go to the Northwest Plaza location to vote on Election Day.
Just for clarification, it's 615-1800?
Oh, 615-1800, thank you. 314-615-1800.
A question on youth sports. There's been some concerns about those restrictions. Based on the data that we have, are we looking at loosening those restrictions at this time?
Right now, the presence of coronavirus in our community is trending in the wrong direction to loosen our guidelines. The environment was right in our community. We saw what happened over the weekend with the Cardinals players testing positive, canceling their games, even in the most intense testing environment with unlimited resources. It is still very difficult to prevent the spread of COVID in the activities that surround youth sports. Although our current guidelines allow kids to come together and practice for skills, all the other activities that including meetings and crowds and fans continue to be considered high risk for spread of COVID based on the opinions of our public health experts.
That's all I have.
Questions? Okay. Thank you.